Hello everyone. Today, we're delving into the world of a medication called fluoxetine, commonly known by its brand name, Prozac. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluoxetine, often recognized by its brand name Prozac, is an oral medication that falls under the category of selective serotonin reuptake inhibitors, SSRIs. Its primary function is to help balance the levels of serotonin, a neurotransmitter in the brain, which can affect mood, emotions, and mental well-being. Initially approved by the FDA in 1987, it's primarily prescribed to manage various mental health conditions. Prozac is commonly used in the treatment of major depressive disorder, obsessive-compulsive disorder, OCD, panic disorder, and bulimia nervosa. It is also sometimes used to manage premenstrual dysphoric disorder, PMDD, and other mood-related disorders. Warnings: Prozac comes with its set of precautions. It's essential to inform your healthcare provider of any allergic reactions you may have had to fluoxetine or other SSRIs in the past. Additionally, if you are taking monoamine oxidase inhibitors, MAOIs, or have taken them in the past 2 weeks, you should not start Prozac due to the risk of a potentially dangerous drug interaction. Before taking this medicine. Before starting Prozac, several factors need consideration. Inform your doctor of any other medications, supplements, or herbal products you are currently taking, as some combinations may lead to adverse effects. Be sure to discuss your medical history, especially if you have a history of bipolar disorder, seizures, liver disease, or a bleeding disorder. If you are pregnant, planning a pregnancy, or breastfeeding, consult with your healthcare provider to weigh the potential risks and benefits of taking Prozac during this time. It's also important to note that Prozac may cause drowsiness or dizziness. Avoid activities that require mental alertness, such as driving or operating heavy machinery, until you know how this medication affects you. Side effects: Like all medications, Prozac can have side effects. Common side effects may include nausea, diarrhea, dry mouth, changes in weight or appetite, and sleep disturbances. It may also cause sexual dysfunction in some individuals. If you experience any unusual or severe side effects, consult your doctor. Furthermore, Prozac may lead to an increased risk of suicidal thoughts, especially in young adults and teenagers. Be vigilant for any changes in mood or behavior, and seek immediate medical attention if you or someone you know experiences worsening depression, anxiety, or thoughts of self-harm. Interactions: Prozac may interact with other medications, including certain antidepressants, blood thinners, and medications that affect serotonin levels. Inform your doctor about all the medications, supplements, and herbal products you are taking to avoid potential interactions. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Prozac. The typical starting dose for adults with depression is 20 mg taken once daily in the morning, with or without food. Your doctor may adjust the dosage based on your response to the medication. It's important to follow your healthcare provider's instructions carefully. Avoid: While on Prozac, it's advisable to avoid alcohol, as it can exacerbate certain side effects and interactions. Additionally, be cautious with activities that require mental alertness, especially until you know how Prozac affects you. FAQ: Many individuals wonder about the duration of treatment with Prozac. The length of treatment varies depending on the specific mental health condition being addressed. It's essential to follow your doctor's guidance on the duration of treatment, and do not stop taking Prozac without consulting them, even if you start feeling better. Abruptly discontinuing the medication can lead to withdrawal symptoms. Closing: That wraps up our overview of Prozac. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.